We'll talk a little bit now about the wide nasal tip or boxy nasal tip or bulbous nasal tip as it's been described. The main concern that it brings to people that seek rhinoplasty for this purpose is related to the proportions of the nose in respect of the rest of the face. Wider nasal tip, and sometimes combined with the wider nasal bridge, creates a dominant effect of the tip. What is behind can be either related just to the shape of the cartilages or the combination of the soft tissues, effectively skin, muscle, and a little bit of fatty tissue that's under the skin, which contribute to the overall size of the tip. There have been many discussions about ideal proportions, but in fairness, my impression is that people feel about their result slightly personally, and I prefer to use computer simulation either in 2D or in 3D to assess with them where they want to be at the end of this journey, because the product, the end result for me is about their experience, about how they feel when they look in the mirror, as opposed to a mathematical expression that they should be happy with. How to change things? If you look at the anatomy of the tip, it's possible primarily to change the cartilage shape, and the cartilages are effectively like two arches, like two domes of support, providing the strength that holds the nostrils open. If they're very wide at the top, if they are like a square shape or sometimes just a very gentle round curve, they can be reshaped, they can be reduced or can be made narrower, and that produces a significant change in the proportions of the tip. This will be attenuated by this thickness of the soft tissues, and therefore in some instances it is possible to reduce a little bit the thickness of the nasal tip soft tissues, but that has to be balanced against protecting the blood supply to the skin. And effectively out of this is a combination that works towards reduction of the size of the tip in the proportion of the face. The degree to which this change needs to be operated is, as I was saying, very personal, and I think needs to be discussed with a degree of detail in the consultation.